This is North Dakota Legislative Review. I'm Dave Thompson. Thanks for joining us. Our guest on the program this week is State Representative Kathy Hogan from Fargo. She's a Democrat. And you've been serving on some different committees, but I do want to talk for the first few minutes here about something that you did during the interim. And you chaired a committee that really delved into the issue of behavioral health. And of course, you've got the Justice Reinvestment thing going on. And what do you think is happening in this session concerning behavioral health and more community-based treatments?
We had many recommendations coming out of the interim committee, and there were 6 major bills, and 5 of those major bills had to do with structure and definitions and expanding training and workforce. And those 5 bills have had very smooth going. We've looked at restructuring the Department of Human Services. We've expanded training on behavioral health for early childhood providers in one of the bills. We've merged mental health professionals in a bill so that psychologists and social workers can have comparable scopes of practice based on their training. The thing that hasn't happened is the primary need, which is expansion of services. The one major bill we recommended was House Bill 1040, which asked for $28 million in funding to expand a full range of services from children to adult mental health, substance abuse, and it came out of the House with $200,000. So it was literally gutted. And so we will have a structure in place and no services.
But there's a chance maybe the Senate might be able to restore some of the money?
I think that there is clearly a chance that there might be a restoration of money. But the realities of it are North Dakota's in a crisis. And the people dying from suicide, from opioid deaths, continues to make front page news every single week. And we haven't really addressed the lack of service.
And what makes the issue so interesting is you hear the judges say that in order to get some people into treatment, they have to send them to prison, which is almost counterproductive because there's a lot of statistics that say if you go to prison, you're more likely to reoffend than you are if you're in a community-based treatment service.
It's absolutely true. And many, many families actually encourage people to arrest their children so that they can get treatment. And so for families, for law enforcement, for judges, and right now I think some of the best treatment we have in the state is in the correction side. And so the Justice Reinvented initiative is very exciting because they are really going to try to address a small portion of the people who are currently in the correction system to get them first treatment and then wraparound service when they're sent home so that they will be stabilized.
Maybe that's the part of the thing we don't discuss very much is the idea of transitioning people from a setting where they're inpatient treatment, so to speak, and then having them adjust to communities again.
One of the nice things about the whole interim Human Service Committee is we looked at the full continuum of care, from prevention to very early intervention to treatment and then peer support and recovery. If you don't have housing, you can't be stable. If you don't have a support system after you come out of treatment, you can't be stable. So what we had done in the interim was really the first comprehensive package to address a range of needs. And I think the blueprint is there. The challenge is the money.
And of course, it's tough in a session like this where everybody's trying to find a penny here, a penny there, looking under every seat cover, looking for pennies. You know how it goes. It's a tough session budget-wise.
It is a tough session, but the realities of it are we're paying for it already, whether it be in out-of-home placement for children in the child welfare system, in juvenile corrections, it could be in the correction side, in local jails. We're already paying for it, but it's just not necessarily in the legislative control, and so you don't see it.
And of course, one other element of this is that it's anecdotally said that if you go west of US 83 toward the Montana border, there may be 1 psychiatrist available. So there's a workforce shortage too.
Well, there's a workforce shortage in many places in the state, particularly in rural communities. But west of the state, last week I had a meeting with a father whose 19-year-old committed suicide last year. And he said he tried to get help for his other children because they were teenagers and he was concerned about them. and it's simply not available. And so if it's not there and you know people need it, what's a parent to do or what's a school to do? And so it is a day-to-day crisis for many families, and we have forgotten about it.
So the solution is not there just yet.
It is not there. I was pleased that House Bill 1040 with the budget passed with its $200,000, so it's alive and we'll have a hearing in the Senate. And the Department of Human Services budget did add $1 million in opioid treatment that was new. And so there's little hopes, but we have not begun to address the problem.
Do you think that, it first really started coming to light? People knew about it, people who are in the know, so to speak, treatment providers and the correction system knew about it. Then the Schulte report came in the 13 biennium, and the 15 legislature didn't do a lot, but then you had the interim study, and you made some progress, but would you consider it baby steps or something more than that?
I always say that it's a 10,000 piece puzzle, and we've got 1,000 pieces at the end of this session in place. So we have a long way to go. This session, we've made really many major steps in the Schulte report. We've added data, which we didn't have. We've restructured the Department of Human Services. Of her 6 recommendations, we have truly addressed 5 of them. It's the direct service expansion that hasn't been addressed.
A side issue that doesn't directly relate to it, but I see some parallels. Senator Poolman from Bismarck has offered this study resolution about the center in Grafton,
Right.
which I knew growing up as a Grafton State School, and with an eye toward closing it and having more community-based treatment for people who are disabled.
I think the whole issue of how we treat persons with disabilities is critical. And many states have closed their state institutions. Senator Mathern had a resolution to take the state hospital out of the Constitution so we could consider that. And so I think many states are trying to provide comprehensive community-based service. The challenge is you have to assure that you have enough adequate community-based services that are appropriately funded. And without really good funding, you can put people in real jeopardy.
And of course, this all comes down with the Olmstead Commission and the Olmstead decision from the U.S. Supreme Court, which said people should be in the least restrictive and closer to the community environment as possible.
And that's why so many states have actually closed their facilities, because there are almost no need to have institutions anymore. If you had adequate, but you have to have 24-hour emergency psychiatric beds available. And in the West, that's very hard to get. And so you also have to have really specialized services for people with severe medical conditions or severe behavioral conditions.
I have heard this discussed in committees, and I want to get your reaction to this. And we go back to the ARC lawsuit of the early 1980s, which ended up costing the state millions upon millions of dollars. The term, "Are you ready for another ARC lawsuit?" has come up in some committees. Are you hearing that too?
Absolutely, I'm hearing that. And I think there are 2 possible options. One is an ARC lawsuit, which is a class action lawsuit representing the class. Or the second is a formal Department of Justice Olmstead claim, because Olmstead came in the late 1990s, and that would require a Department of Justice review of our system. And I think we would fail on both a class action and an Olmstead claim right now, because we know we have real cases that are not getting services.
And of course, that bleeds over into the idea of treating addictions and treating opioid addiction, things like that. So there's a lot of talk about that.
I think the other piece that has happened in the last 3 years that's different is we have gotten so that people are talking about it. The stigma, I think, is much better. The families are sharing their stories, and I think the whole idea that addiction is really a disease, it's not a personal choice. I think that people with significant depression are willing to talk about it. I think we've made some headway that way. I think the difficulty for the legislature is unless you've actually had a family member or a neighbor, you don't understand how debilitating illness can be.
I need to switch gears for just a second because it's on top of mind because the hearing was held in the Senate. The House dealt with some changes to the Public Employees Retirement System Board of Directors and governance, and that caused a lot of consternation on the floor and in the committee. I know your caucus was not happy about it. How did you see this whole thing rolling out?
Well, when we heard the PERS budget last week, in that PERS budget were some major policy changes on restructuring the PERS board. And my concern about that is, first, I don't think from a process point of view that should be done in an appropriations bill. So I didn't feel comfortable with that. And then the second piece is the whole restructuring was very disrespectful of the PERS membership. I think it didn't have an appropriate hearing. It didn't have due process. There were so many things wrong with the idea. And if we had the idea, it should have been a freestanding bill. It should have had a clear public hearing, none of which happened. So I'm concerned about the process, and I'm concerned about the content.
I know we should tell our listeners and viewers that what it does would make the PERS director, the director of the Employee Retirement System, a cabinet-level agency directly appointed by the governor. The governor does not directly appoint now and appoints the chairman of the PERS committee. And the PERS committee would become an advisory committee, and then a legislative committee called the Employee Benefits Committee would meet quarterly and have some oversight over it. And it seems to have been really kind of sparked by the change in health insurance.
Yes. And during the floor, one of my issues is health insurance is a component of the Public Employees Retirement System, but the primary responsibility is really to manage the retirement benefits for public employees, both state employees and many local political subdivisions employees. And this proposal essentially takes the members who have contributed to this fund out of having any influence. And I think that's very dangerous. I think other states that have politicized their retirement systems have ended up in trouble. This is a very, very dangerous bill.
And one of the troubles that your caucus talked about was the fiduciary responsibility.
Yes.
And that's very interesting because I was talking with the people of the North Dakota United, said that the real concern is that the governor may be conflicted. If the governor has direct control over who leads PERS, there could be a conflict in fiduciary responsibility to it. So.
And that fiduciary responsibility is what has gotten other public employee retirement systems in trouble. Our current system has been very solid, and to tinker with it, particularly in the last moment, is really concerning.
I know the Senate committee, it was actually taken to a policy committee, and I know that some people were questioning that, but the whole idea of making the policy change was taken to a policy committee in the Senate. They've held a hearing, and there was some promised amendments about fiduciary responsibility. But do you see that as one of the main issues that might be a hang-up between the Senate and House as we get toward the end of the days?
I think this is going to be one of the major kinds of points of contention about the future of public employees' retirement. And I think for public employees who are facing major concerns right now, with the lack of any salary adjustments for the next 2 years, with the major layoffs throughout government, then to be losing their stable retirement system, I think is a very serious problem.
So stay tuned to this one.
This
2
is
years ago.
2 years ago, the last bill was the PERS bill.
Yes.
It's the bill that went into the June special meeting.
There is one thing, speaking of that, because there was another big hearing going on at the same time as the PERS bill, and that was the DOT budget, which has now become a matter of consternation because of the proposal to close 8 shops around the state. And I know there were busloads of people who were looking at that, and at least a few of the legislators I talked to afterwards said that could be one of the last bills that's going to be voted on too.
I think it could be. And I think the interesting thing about that is it's an opportunity for us to look at our rural communities, because like the main people who do the roads in Trail County live in Mayville, but the shop is in Hillsborough. And so if there's a bad storm, they can't even get to the shop to do the work. So there's some reality. We live in North Dakota. We have to have core infrastructure in place.
And of course, that reality was hit home by what has been a tough winter in parts of North Dakota.
Very tough. That Northeast has really been hit.
Yeah. Any concerns about any other budget matters that you're looking at particularly?
I think the overall budget process is going to be very concerning. I'm very concerned about higher education. The 15 to 20% reductions in higher education are really going to gut many core programs. I think class size, I think availability of classes to get majors. I think we haven't seen this level of reduction on the higher education side in decades. And so I'm very concerned about education.
And the Senate has already taken its look at that. It goes into a House committee, and of course, you've got the March 9th revenue forecast, which may or may not make some serious changes in things.
I think it's hard to predict. The assumptions will be decided this Friday when we look at what kind of assumptions we're going to use in that forecast. But the realities of it are we're going to have a tight budget because we've cut revenues over the last 3 or 4 sessions consistently. So we've cut income tax, we've cut corporate tax. We have become so dependent on oil that we don't have a stable financial base. And nobody really is talking about the revenue side.
Yes, and in the past few bienniums, the legislature has cut income tax, corporate taxes, and did make a reduction in the rate of oil taxes.
Absolutely.
So that there are some who would argue that that has not been good. So let's put it that way.
I think the legislature created the dilemma. I think we have to solve it, but I think we created the crisis we're in today. You can't blame it on oil prices or egg prices. That's one factor, but the legislature really did create the problem.
Now, are you on the budget forecasting committee?
No, I'm not.
But I have to ask you this because in talking to Lynn Helms, he said that the state should really rethink sales tax and how that's collected because he said when you saw the big growth in sales tax, you had oil rigs coming to North Dakota and they paid sales tax. Then they were replaced and they had replacement parts, they paid sales tax. But in the latest slowdown, the rigs never left the state, so they're not coming back and that sales tax is not going to be collected. Of course, you get sales tax off fracking and that type of thing. That'll help. And completed wells are almost money in the bank, piggy bank.
They are.
But can you bet on that? That's interesting.
I think it's hard to bet on any of it. I think the interesting thing about sales tax is we've become very dependent on sales tax. I was in Ohio last weekend, and my drink that I get every day in the morning cost me $2.95. I came here and it cost $3.18 because our sales tax is so high. And when I pay that 23 cents every day, I don't notice. But when I get my property tax bill, I do because it's all in one place. Mm-hmm. And so we've become so dependent on the invisible sales tax that the average citizen doesn't realize how much they're actually paying.
And that's interesting because everybody complains about property taxes, and there is the bill that's going through. The Senate has passed it, I believe, to have the state take over all funding of county social services, right, which is going to lower your property taxes. And there seems to be some pushback from the House.
And we haven't heard that bill yet. I think we're having the hearing next week, so I haven't heard what the pushback is. But again, this is the county social service, and the funding of that is county social services are mandated to do everything they do by the state, but they're funded with property tax. Mm-hmm. And if you're mandated by the state, if the state actually funded it, we wouldn't have such high property tax.
Therefore comes the idea of unfunded mandate.
Totally.
So there are a number of kind of sticky wickets all over the place yet in this session. And I know legislative leaders are trying to hold 10 extra days that they can. As we sit here today, what do you think the possibility is of that?
I think we are going to do it because you look at the raw number of bills that we have left. The simple bills we're going through very quickly this week. And I think the bills that will go to conference committee will start maybe as early as the end of next week. And I think the complex issues will be the end of March. I think we might be done by the middle of April.
Okay.
I think everyone knows we may have problems with Medicaid expansion and that we may have budget problems. Long term, our big budget problems is we're draining our reserves. in this session. And if we don't have wise decision making, we're going to end up in a real problem in 2 years.
So you say draining the reserves, of course, also dipping into the Bank of North Dakota profits.
Absolutely.
And there's some, at least, toe in the water about the legacy fund.
At this point, we're going to take the interest. I think everyone agrees that we're taking the eligible interest. I haven't heard any talk about going into the big legacy fund, which would take a 2/3 vote.
Yeah, that would take a 2/3 vote, but the interest is now available.
I think it is.
And I know there was some thought 2 years ago that they should just leave it alone and not touch it, but it looks like reality is setting in that you have to touch the interest.
But budget stabilization is weak, the SIF fund is weak, and those are the funds that we've gone to this cycle so that we had someplace to go.
There's an odd bill that was a constitutional amendment that was introduced by House Majority Leader Al Carlson. I just wanted to get your reaction to it about the state getting into the gambling business by having casinos.
I read about it in the paper, and I haven't seen the bill yet. It sounds like it just got dropped in the last week, and I'm not sure exactly how that all happened. I think, again, it's a topic that is worth discussing, but we haven't seen it and had any discussion. And to go straight to a constitutional amendment without a discussion, I think, is a little scary.
Yeah, I think there will be some kind of committee hearing.
There will have to be a committee hearing. And I think the whole question is, I think about the blue laws and how we didn't want Sunday opening, but now we want to open up gambling in this state in a way that hasn't really ever been considered, I don't believe. And I'm really shocked at that.
And I'm talking to Representative Carlson, he said one of the things he'd like to do is eventually eliminate income tax in North Dakota by replacing it with taxes from the casinos.
I think that's appalling because I think we have to have a tax policy that is imbalanced, and income tax, I think, has to be one of the pillars. Sales tax is regressive, property tax is regressive, and income tax is the fairest tax of all. And for us to eliminate that, who tends to gamble? People of low and moderate incomes. I think this is very regressive taxation, and we have to be very, very careful of that.
Just very briefly on a couple other subjects. State employees 0-0, but the proposal from two governors to have, or at least one governor, to have state employees pick up 5% of the health insurance, that's going nowhere.
No.
It sounds like that's off the table now. But how does this set things up for 2 years from now?
I think 2 years from now, if we don't have significant revenues, if oil doesn't come back, or egg, which really does impact us significantly, we will be in additional budget cuts. And we don't have anything to cut left. And so I think 2 years from now, we're really going to have to rethink our entire relationships.
And I was thinking, because the Senate Majority Leader, Rich Wardner, has said that you're going into bone now.
We are
with
in
the
bone.
Cuts. We're in bone, yeah.
We are in bone. And I think the average person isn't going to see it until they need to go to get their driver's license renewed. And instead of an hour wait, it's a 3-hour wait. And we're going to see it in subtle little ways of irritating, and then we'll be angry at government because they're not providing the service they should. Well, we are government, and we're making the decisions.
Well, mentioning driver's license, maybe think about the voter ID bills that's going through, and it's gone through one chamber now.
Yep.
What is your reaction? Because there was a lawsuit concerning this, and the judge had said something about a fail-safe, and the majority thinks there's a fail-safe in this now.
I think the realities of it are we had the old affidavit method for decades, and we had no evidence at all of voter fraud. And sometimes we create a problem when there's not one, and I think we're trying to fix something that wasn't there. And I think many of the county auditors said the affidavit system worked fine, and I think sometimes we create our own problems.
So at this point, you don't like the bill.
I don't.
If you had your druthers, then you would say, let's keep the affidavits in.
Absolutely.
Would you go to a provisional ballot type thing?
I think a provisional ballot is one of those things that we could look at, but I don't like writing bills when we do it quickly. I think we should study it. We should see how other states who use provisional ballots work, And I think we could easily study that. Because we have a lot of checks and balance in our voting system, and we haven't ever really had any evidence of voter fraud, but you'd think we had massive fraud by some of the bills that we've considered.
So at this point, a solution in search of a problem from your
Absolutely.
perspective. Any other things that we might have to watch toward the end of the session?
I think one of the things that's very serious and concerning is the whole issue of funding of long-term care. And we saw it with the first proposal that we have an assessment on private pay people, which went down. And then we had the proposal last week that we changed the reimbursement mechanism, and that went down. And we don't have a plan for how we're going to fund long-term care.
Okay, well, things to watch, I guess.
Things to watch.
Well, thank you for being here.
You're welcome. Thank you for having me.
Our guest, Representative Kathy Hogan from Fargo. She's a Democrat, and for Prairie Public's Legislative Review, I'm Dave Thompson. Thanks for joining us.